Movement and Fitness, Education 330, Week 4. Let's roll. Children progress through predictable stages of motor development, although the rate of development may vary. No two children have the same physical characteristics, and they are unique in their development of motor skills. Motor development is defined as the changes that occur in human movement across the lifespan, which are influenced by biological characteristics and the environment in which individual lives. Motor learning is a relatively permanent change in performance as a result of practices or repeated experiences. This is called muscle memory. Patterns of development. Patterns are genetically determined. There is a predictable pattern that children experience. Years of slow, steady growth enable children to explore how their bodies function and move. Their height, weight, and muscle mass increase most rapidly during infancy. There is a steady increase in height, weight, and muscle mass throughout childhood. Early childhood, ages 3 through 5, they gain in height and approximately 2.75 inches per year. At ages 6 through adolescence, they gain height in approximately 2.25 inches per year. Average weight gain during early childhood is approximately 2.5 pounds. Average weight gain during later childhood is approximately 6.5 pounds per year. Gross motor to fine motor skills, big to small. Years of slow, steady growth enable children to explore how their bodies function and move. Gross to fine motor skill development always makes me think of Legos. Originally, Legos only had the small size Legos, the red ones. Then the development of Lego Duplo for the younger children to assist them in the development from the gross motor skills to the fine motor skills. Let me see if I can say this right. Cephalocaldal. The cephalocaldal pattern is where the greatest development takes place at the top of the body, i.e. the head, and physical development gradually moves downward to the neck, shoulders, and trunk. Patterns of development. Proximodistal. Proximodistal is a general tendency of the development of motor skills to start in the center of the organism and radiate outwards from there. The middle is the first to develop, and movement extends outward from there. Infants will first learn to move their torso and then their arms and legs. Once the motor skills for their limbs are developed, then finger manipulation and other fine-tuned motor movements will develop. Muscle atrophy is defined as a decrease in the mass of muscle. It can be a partial or complete wasting away of muscle, and it is most commonly experienced when persons suffer temporary disabling circumstances, such as being restricted in movement and or confined to bed when hospitalized. Development of fine motor skills. As children develop greater use of muscles of the hand and fingers, fine motor control improves. The drawing of the 4-year-old, drawing A, displays little precision, while the drawing of the 7-year-old displays much more detail and precision due to the increased fine motor control in picture B. Abnormal motor development influences. A balanced diet and additional water consumption are critical to the development of the fetus in order to provide the necessary nutrients to assist in development. Recreational drug or prescription drug use by the mother during pregnancy may lead to abnormalities in the motor development. Mental retardation, attention deficit disorder, low birth weight, central nervous system deficits, eye defects, hearing loss, and congenital heart defects are among the abnormalities the newborn may experience. It may be determined that a child would be in a special needs educational program as a result. Variability among children. Dynamic systems perspective. Basic premise is that motor development is nonlinear and consistently changing, more like a spiral rather than a straight line, and is influenced by Variability among children. During pre-adolescence, boys will show longer legs and arms, and girls will show greater hip and thigh width. Variability among children. Dynamical systems perspective. The basic premise is that the motor development is nonlinear and consistently changing, more like a spiral rather than a straight line, and is influenced by task-specific movements, individuals' unique qualities, environment, factors that influence development, including practice and instruction. During adolescence, boys will show longer legs and arms, and girls will show greater hip and thigh width. Effective implications for motor development. Play is an important factor in children's socialization and motor development. Through play experiences, children emerge from the solitary activities of preschool children to develop cooperation and leadership skills in the elementary school. Through physical activity, children gain a sense of their competence in relation to their social group. Self-worth and self-esteem may be hindered if children perceive that they are less capable than other children. Kindergarten children learn social skills through play and interaction in the classroom. Stages of performance. Children progress through the stages of motor skill performance independent of their age. Movement educators need to recognize the stages of performance of their children and meet their needs at their level of performance. Keep in mind the concept of simple to complex skill progressions. Stages of performance. Beginning. The learner is getting the idea of the movement and how to coordinate the body. Intermediate. The learner is beginning to refine the movement and make fewer errors. Advanced. The learner is automatic in performance of the skill and thinks little about the execution of the skill. Transition across these three stages is dependent upon appropriate opportunities to practice, encouragement, and feedback from a knowledgeable instructor, and a learning environment that includes appropriate sized equipment, facilities for practice, and ample time allotted for practice. Appropriate progressions. Children at the beginning stage of performance need maximum opportunities to independently practice movement skills. It is important to schedule ample opportunities to practice the whole skill or the skill of various parts. When the skill is fairly complex, children may benefit from practicing parts of the skill before the whole skill. Part practice reduces the cognitive processing so children do not become overwhelmed. Checking for understanding. Pause the video and answer the checking for understanding questions. When you're done answering the questions, restart the video for the answers. Checking for understanding and understanding. The answers. Development is not predictable. True or false? True. Development is not predictable. What are the three stages of performance? Beginner, intermediate, and advanced. Explain the simple to complex progression. Start with a simple skill and gradually progress to a more sophisticated skill and combinations to a complex skill. Nice job. Recommended teaching progression. You begin a skill by allowing the student to explore the skill by themselves, kicking a ball alone. Then add a partner to kick the ball to, and it is kicked back. They can compare the way they kick the ball with their partner. Place the student in a small group so they can kick the ball to each other in a circle, so they can compare, evaluate, modify, and adapt their skill. Progress to a larger group activity where all students have equal opportunity to kick the ball in a larger group so they can compare, evaluate, modify, and adapt their skill. It is essential that the teacher provide opportunities for the student to improve their skills with development appropriate instruction in a non-competitive environment. Individual variability. Activities need to be modified to meet children at their level of readiness. Poor performance may be demonstrated through a slow response to do a movement, poor quality of movement, or total disregard for the activity. When too many things are presented to children within the learning environment, performance may be poor. Examples: requiring the learner to think about too many things, creating a learning environment that is too unpredictable, asking the learner to perform a skill that is too complex for his or her developmental level. A child that is overly excited may also demonstrate poor performance as they are distracted by too many things in their learning environment. Accounting for readiness. Observe and reflect on the student's performance. Has the child mastered the prerequisite skills? How does a child look when performing motor skills of lower or light complexity? Is a child capable of manipulating equipment, or does the equipment control the child? These are the things we as educators need to evaluate before moving on to the next skill. Other considerations for skill development include equipment and environment. Large, lightweight balls and a closed environment are appropriate for beginning level performers. Environmental types. Different types of environments are better for teaching different skills. A closed environment is a predictable environment. It does not change. Necessary for beginning skill, hitting off the tee. An open environment is an unpredictable environment and changes often. Necessary for intermediate and advanced skills. Receiving a pitch in a game. Concept of feedback. Prompting children through questions about a motor performance will help children to begin to develop their own feedback capabilities. Congruent feedback that is focused on one cue at a time will help children focus their efforts. Develop a list of cue words that describe the critical elements of the motor skills. Give feedback on the critical element of the task before moving on to other parts of the child's movement. Checking for understanding. In the written blog, Teaching Progression, explain the following two questions. What is the recommended teaching progressions for skill development? Describe developmentally appropriate instruction and the importance of feedback. Pause the video while you complete the Teaching Progression blog and then restart the video for the next part. The Hall of Shame was created back in the 90s, and you'll get to read all the versions of it throughout the course. We're going to go through the elements of the Hall of Shame. Now, keep in mind that our goal is 100% participation when we do activities and skills. Do these elements affect those goals of that goal of 100% participation? The first element, an absence of educational and learning objectives. Do we have one? Did you put it together, the game together, to have an educational objective? Potential embarrassment for children. Are we singling those kids out for embarrassment? Elimination of children from the activity. Do you get to play for a while, and then if you're out, then you don't get to play and you get to sit, so your physical activity is decreased? Overemphasis on fun rather than learning. Both are important, but we can't overemphasize the fun. Lack of emphasis on skill acquisition. Kids want to learn how to learn a game and be able to be better at a game, and we need to promote practice of skill acquisition rather than the lack of that emphasis. Low participation time. If you're out, you're just sitting on the side. You don't get to participate as much if you're not one of the better students. So we need to increase that participation time. Likelihood of danger or risk of injury. Is there a possibility where somebody might get hurt? If one student gets hurt and the other students see that, that will decrease their motivation and not want to participate in that activity because they don't want to get hurt. Sometimes the fear doesn't, we don't think about it that way, but kids, when they get scared, they just don't want to do stuff. So it's important to keep things safe for them.